The Senior Health Program Officer, Twilika Kamati, notes that the ministry is working towards addressing the issue and developed an adolescent and young people job aid aimed at empowering healthcare workers to provide quality healthcare services to adolescents. Kamati, who made these remarks at the Government Information Center this week, further urged healthcare providers to put aside their cultural norms and beliefs and provide healthcare to anyone who needs it.
The ministry is having a policy or a national policy on sexual, reproductive, and child health care that also states that citizens or people who are sexually active should access family planning or should be explained or given information or family planning methods available, and they should have or be given family planning method of their choice. Mm-hmm. There is a policy that is in place that is allowing adolescents or people who are sexually active to access contraceptives. So for me, there is no legal barriers per se. However, when it comes to provider bias and stigma, yes, that does happen, and the ministry has learned about that, there are some challenges or bottlenecks when it comes to the provision of sexual and reproductive health services, more especially adolescents. They do sometimes come across those challenges of coming to facilities and they are not provided with the services. However, the ministry is working on that. The policy I'm referring to, the national policy on sexual, reproductive and child health policy, it states it clearly that all adolescents should have the right or can access sexual and reproductive healthcare services without parental consent, as long as they are going to be provided with information or proper counseling, unless it's in a case of a surgery. Okay. And when we are referring to adolescents, we, in Namibian context, we know we are referring to boys and girls aged 10 to 19 years. Okay.
Volunteer at the Namibia Planned Parenthood Association says there is a need to harmonize the policy framework to ensure full access to contraceptive services and further urging healthcare providers to change their attitude when providing contraceptive services to adolescents.
And those are some of the issues, because if a young girl at the age of 12 is coming for contraceptive, that means that this girl is sexually active. And it also means that most likely this girl is having unprotected sex due to various reasons. And I think those are some of the harmonizing of policies that we really need to work around in order to make sure that we have full access, or making sure that these young people and adolescents have this access. But also besides that, you also have a challenge, and I think this is where NAPA plays a critical role, in a sense whereby you have youth-friendly services, because sometimes we need to understand, sometimes the nurses at public health facilities, we're not pointing fingers to say, no, they are rude and they are what. No, we need to understand that we are speaking about two different age generations here. And we need also to respect that this nurse that is at the government health facility, she might be very good at treating wounds in terms of stab wounds and so forth, but she might, her cultural background and her morals doesn't allow her to be treating this young girl or young boy, because many times we have seen, especially the older nurses, they will say, like, these are like our children. And the funny part is, young people have said it time and again, we are not your children. We are clients, and we need a service. So I think those are some of the issues that we need to work around when we are coming to youth-friendly services for young people.
The Ministry of Health and Social Services is investing in capacitating healthcare workers to be able to provide quality healthcare services, while at the same time educating public members to demand and access various healthcare services.